are present and can hear me. Andy? Andy?
Hi.
Hi. Alan?
Present.
Tom?
Yes, dear, I'm here.
I will, Margaret from Civil Site Engineering.
Here.
And I'm not sure if Bill Halsing was calling in or not, but he's here for the other local upgrade. And I don't see a number listed. Bill? Okay. So, good evening. This is the open meeting of the Mendon Board of Health. Is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of the public bodies are allowed to and encouraged to participate remotely. The order in which you can find posted with the agenda materials for this meeting allows public bodies to meet entirely remotely so long as reasonable public access is afforded so the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. For the meeting, the Board of Health is convening in telephone/video conference via Microsoft Teams, as posted on the town's website, identifying how the meeting public may join. Basically, just don't talk over each other. The chair will call the different board members, blah, blah, blah. I'm sorry, I get tired of reading this. So with that, I'm going to turn it over to Andy for the first item on the agenda, which is a local upgrade for 10 Pine Needle. I did email you guys each a copy of the plans and Tom Ryder's recommendations. So Andy, I'll turn it over to you.
Okay. I do not have that email opened up right at this moment. I'm looking for it while we're talking. What is the upgrade looking for?
I'll let Margaret speak to that.
Okay.
Thank you.
Good evening, Margaret Bacon. I'm an engineer with Civil Site Engineering, and I'm here requesting a repair or a local upgrade for a septic repair for 10 Pine Needle Drive. Basically, I have an existing septic system that was installed in the 80s, and the way I have how the plumbing comes out of the house and then it goes underneath a deck where the existing tank is under the deck. So I can't easily access that plumbing. And I've been in the house and it's not something I could replumb inside, because basically what's happening is the existing tank is about 3 feet below grade. And I'm not sure I can access that sewer pipe easily in an effort to raise it up so that my septic tank's not buried by 3 feet. I probably really won't know till we start digging around the foundation to see if I can't grab that sewer pipe as it comes out of the foundation before it gets to the septic tank. The current septic tank's underneath the deck. So it just creates a situation where if I can't access it, my new septic tank may be at 3 feet or slightly deeper below existing grade. And if that's the case, I would put in an H20 tank if a waiver is allowed. Does that make sense?
It does. By how much over 3 feet would it be?
Well, the existing septic tank right now, we measured down, and it was just a little, the invert was just a little over 3 feet deep. So if I can't, scratch back towards the foundation more and grab that pipe earlier, and if there's enough of a pitch on it, I'll have to connect where that existing tank is. And so it probably 3 at the most.
I know that Title V says 3 feet. I think that Lenny would probably be okay with it if it was only, say, 6 inches. I just feel that, and again, it's up to Lenny and Tom, but, in my opinion, going for the H20 tank is substantially more money for the homeowner. And is it really necessary? It's not going to be driven over, right? It's besides a deck.
Yeah, well, the deck's going to stay in place. So basically what we would do, if we could
Yeah.
remove the old tank, we'll remove it. If not, fill it with stone and just pipe through it, you know?
Right.
Put a new septic tank on the other side of the deck so it's not under the deck, but it'd be in the backyard, driven over now. And then it's a pump system too, so, elevation doesn't matter because I got to pump up to the system anyways.
Yeah, okay. So is that the local upgrade you're looking for, the 3 feet difference?
Well, that's it. I'd rather kind of have it in place in case we need it. And if I don't need it, then, I don't have to worry about it.
Okay, I can't open the email. I'm trying right now while we're talking and it will not open. Missy, could you please read Tom Ryder's recommendations on this, please?
Sure. So Tom wrote that the applicant is requesting a local upgrade approval for the proposed septic system repair for the above referenced property, which is 10 Pine Needle Drive. Title V requires that the septic system components have the maximum cover of 36 inches. The board may vary the acceptable depth up to 72 inches, provided that the proper ventilation, access, and construction measures are provided. The applicant is requesting the proposed tank, if found that the field change is necessary, to have more than 36 inches of cover. The applicant would utilize an H20 septic tank if this design change is needed. The proposed plan does not show that a greater than 36-inch depth is required. However, the engineer expressed concerns that some modifications may be needed during the construction, and it will be determined at the site the site's excavated, exposing all of the utilities in the area. I'm recommending the approval of the local upgrade request as provided.
Margaret, is the finish grade going to stay the same, or if it's only 6 inches, can that be adjusted? The jump in value in money from an H10 to an H20 is substantial. If it's not necessary, I'm just trying to help the homeowners. Do you know if the finish grade can be changed?
Well, if I did that as kind of a flat backyard, I think I'd create a little depression. Now, it's always under my impression that these tanks, you'd want an H20 if it was buried more than 3 feet. I'll have to check the loading on that. If that's not a concern, and a regular tank is structurally strong enough, then I'll use a regular tank. Just an assumption, over 3 feet, you need a bigger tank, or even if you put the top half as H20. Well,
yeah.
let me look into that. If it's not necessary, if I'm hovering around 3 feet, then I can leave a regular tank in.
Just for so that my board members understand, Tom, first, do you know the difference between an H20 and an H10 and an H20 tank?
Other than a 10 number differential, I do not. That was actually going to be my first question.
It's the thickness of the
you or
concrete.
Margaret could explain that. That'd be great.
There is a technical description for it. Margaret probably knows it. I've seen it. I don't remember it, but basically it's 6 inches of concrete, whereas an H10 has, actually, I think it's 9 inches and 6 inches is the difference. What it is it's stronger for the extra loading on the top so that it doesn't cave in. Typically used if it's under an area where it's going to be driven on, such as a driveway or a parking lot or something like that, or also if a buoyancy is an issue. If they go with a heavier tank, it keeps it from floating if you have a lot of groundwater. Margaret, do you know the technical definition?
No, I think you pretty much covered it pretty well.
Basically, it's just thicker concrete to make it structurally stronger, and over 3 feet, which is the parameter that they use. But in my opinion, 3.5 feet, if that's what it is, I don't think it's necessary. Alan, do you have, first of all, Tom, does that satisfy your question?
No, I appreciate that. So basically, in comparison to what we're using, what would be a quote-unquote regular tank, so we're talking about the typical 2-compartment tank that we normally require that would be going in, except this one would be just the H20 version versus an H10 version. Is that correct?
Correct.
Correct.
Okay. Yep. Great. Thank you.
Alan, any questions?
Nope, I'm following along. Thank you.
Okay. In my opinion, Margaret, but I may be wrong in this, but in my opinion, as is found on site when it's exposed, it would be up to the discretion of the installer. If it was 42 inches, we'll have to use 6 inches as a difference, because I just don't think that that's close. I mean, that's so much difference. It's up to the discretion of the installer at that time. Certainly, if it goes to 4 feet, by all means, you would need an H20, which Tom Ryder has embraced and said it would be okay. I don't think I'm overstepping my bounds in saying if it was 42 inches, then use an H10.
Okay, and I'll confirm that too with the tank companies.
Okay. I may reach out to Lenny and see what he says. If Lenny feels that that's not correct, then I will get in touch with you.
Okay,
All righty.
sounds good.
Thank you.
Thank you.
Missy, which one's next? 6 West Hill?
Yeah, 6 West Hill. So for the previous one for 10 Pine Needle, do you need to vote on anything, or is there no need of a local upgrade? I'm a little confused, just for the minutes.
Tom,
Well, I was actually
you
going
make
to chime in, on that. I think because there is a request here, although we don't know if it's going to be utilized, I would think we'd have to vote the approval based on the contingency that Tom Ryder has laid out in his recommendation that if needed, and based on that outline, we'd be approving, we were okay with the local upgrade should these elements fall into place as Tom has outlined that. That's how I'm viewing it.
Yeah, because as Margaret stated, they're not 100% sure what the elevation of the pipe is when they expose it. So that's like a gray area. So I could have a motion with what Tom just said.
Yeah, so I'd be happy to put the motion in such that I would motion that we support or approve the local upgrade approval has deemed necessary should it become required, has outlined in Tom Ryder's letter to the Board of Health.
Alan?
I'll second the motion.
Thank you.
AJ,
Yes, sir.
one thing, as you were discussing the tanks, this new tank is going to be a 2-compartment tank, correct?
Correct.
Yes, we have. Yeah. Okay, Margaret, still you're good.
Okay, so doesn't that interior petition also add to the strength of the tank, whether it's an H10 or an H20?
No. Nope, the divider
Does it
does
go
not
all the way to the top? Right. Okay.
just like my elevator.
There you go. No, I didn't know if, even though it doesn't go all the way to the top, I didn't know if it added to the integrity of the tank.
No, it's just a divider that usually just the inner walls of the side walls of the tank are grooved, and on some of them, it depends on the manufacturer, and the divider is 4 to 6 inches thick, and they slip that in, and all that does is separate the 2 chambers.
Okay, I didn't know if it was part of like the original pour. I got
Some of them are. There are some that are monolithic, and the divider is part of the lower half of the tank, but it does not go all the way to the top.
Gotcha. Thank you.
Alrighty.
Alrighty, so 10 Pine Needle is all set. So the next one, thank you, Margaret. So do you have everything that you need?
I'm good.
Okay, thank you, and we'll see you next time.
Thank you, Margaret. Before you go any further, I've got a quick question.
Yep,
When I try to open the emails that you have sent, the request will not open up because it says PDF file. But yet when I go to Tom Ryder's letter, those do open up. Is there a different type of email that you're sending? I'm not computer savvy.
but they are different. I mean, the PDF is what the plan is. Tom Ryder's memo is a Word document.
Okay, so that's the
So that
difference.
might
That's
be
why.
Yeah, that might be the difference.
Okay.
So the next one I have for you guys on the agenda is for 6 West Hill. It actually needs to be changed to 6B West Hill because that is the legal address according to the assessor's office because they split off the lots.
Is this Gary Gaffney's house?
Yes. So I'll
Okay.
just let Bill know that we need to make sure that the addresses are correct, not to have any confusion. So I'll read Tom Ryder's memo if you want me to. Just for the record, it says the applicant is requesting a local upgrade approval for the proposed septic system repair for the above referenced property. Title V requires that the soil absorption system have at least 4-foot offset to estimated seasonal high groundwater table. A 3-foot offset is allowed for repairs with a local upgrade approval. The applicant is proposing the soil absorption system with a proposed offset of 3 feet to the estimated seasonal high groundwater table. As this is a repair in the site limitations create constraints to upgrade to Title V's new construction standards. I am recommending the approval of the local upgrade request as provided.
So this is Gary's existing house because it's a repair?
Correct. Yep.
Piece of cake. Can I have a motion, please, Tom or Alan? Unless you got something to say about it.
I'll make the
I'm
motion to, I'll make the motion to accept the, repair, the local upgrade from, 4 feet of groundwater to 3 feet of groundwater for 6B West Hill Road.
I
Thank
second the
you.
motion.
Thank you.
Okay, so that takes care of, and just on a side note, just so you know, because there was no abutter notifications for either one of these. That's why they kind of came in last minute, just so you know.
And just to confirm, there was no requirement for an abutter notification in these cases, right, Missy?
Correct. Yep.
Okay, great. Thank you.
No problem. Otherwise, we would be waiting to your meeting in November to do that to make sure the proper notifications were done. So the next thing on your agenda is update on COVID-19. So as you guys are aware, the numbers in Massachusetts are going up. In fact, travel restrictions from 2 other states, if people from Massachusetts want to travel, we've been put on their naughty list, and that is the state of Connecticut, and I'm pretty sure it's the state of New York. So the Connecticut, because of our levels going up so much, there's a travel issue with the state of Massachusetts now. Things are changing. But Andy, go ahead. I'm sorry, I misspoke. Normally you
Oh,
start.
no, not at all. You're doing wonderful. Just for clarifications, is it Connecticut and New York are ganging up against Massachusetts? We can't go there. Is that how it is, or is it the other way around? Massachusetts isn't allowing them.
It's them ganging up on us.
Okay, that's what I thought.
Yeah. So as far as I know, Massachusetts has not done those restrictions with those states as of yet. So you can still travel to Connecticut, New York, New Hampshire, Vermont, Maine. I think it's Hawaii. It might be Washington State and California, or it could be Oregon. I can't remember, but California was there. So, as time is going on, restrictions have been lessened in the state of Massachusetts, but the rates are going up. I guess the higher rates are going up between the ages of 18 and 39. So I'm gonna put on the website the guidance that the governor has put out for people for Thanksgiving. It's the small gatherings, I guess, that are causing these large increases also. We also have limitations that have been lifted. The other thing I wanted to bring up, I don't know if you want to talk about it now, Andy, the fining, but I'll leave it up to you when you want to discuss that.
No, let's do that now.
Okay. So going back a couple of weeks, I received a complaint, an email complaint from a person who had recently gone to the New England Steakhouse, complaining about the restaurant was at capacity. There was no, distancing between tables and whatnot. So I sent Lenny up there. He talked to the owner of the restaurant and everything. Thought everything was good. I went on vacation. When I came back from vacation, there were 2 more complaints of the same thing. The restaurant being packed, no social distancing between tables, So Lenny went up on October 22nd and leveled a $200 fine to the establishment. It's my understanding through your health agent that the owner of the restaurant has told him he will not pay the fine, nor will he change the way he is doing business in his restaurant. Lenny said, okay. I actually have the citation, the yellow and the white copy here in the office. That was the October 22nd. On October 26th, I received another complaint from a person who went to the steakhouse. Not only did they complain about the restaurant being packed and no social distancing between tables, she also mentioned that the bus people were not wearing masks properly. They were having them below their nose. The waitress or the woman, whoever was filling up the water glasses, also had her mask down below her nose, and the hostess did not have a mask on at all. So Lenny, I know, was going to call, and I have reached out to the state as far as exactly what the board can do if we continue to receive these complaints and if the restaurant owner will not change his ways. I did email Ron O'Connor, and he was sending it to the division of, no, what did he say? I forget where but someone will be in touch with me. So that's not the first property, that's not the first establishment we find. I think it was back in September, the beginning of September, Hideaway Pizza, a $200 fine for failure to wear masks. Yeah, so that's what I have going on as far as COVID, as far as complaints. Andy?
Yeah, pretty much that's the only facility currently, the only place in town we have any complaints.
Correct. Sorry.
That's all right.
I've had people, some of the emails that we have, they can't understand why this particular restaurant is allowed to work this way. It's based on complaints. I also reached out to the state to find out when is the Board of Health really supposed to get involved, because when this very first started, you weren't supposed to make your own regulations or your own judgments. Now the state is letting, because all these different towns are different, whether you're a red town, a yellow town, a green town, a gray town, can make things stricter or not open up and whatnot. So, so I asked them, when are we supposed to, you see things on social media, whatnot, and they said if it helps us with our resources and we just want to answer to complaints, that's fine. They're the only ones that in the month of October, I've gotten a complaint on, and it's been 3 or 4 of them about same reasons.
So, since Saturday's complaint, Lenny, you had reached out to Ron O'Connor, and was it you or Lenny that reached out?
I reached out to Ron O'Connor and Lenny was reaching out to Mike Coughlin.
That's it. And has he got any response yet, do you know?
No, I haven't gotten anything.
Okay.
I tried calling Lenny today, but he didn't answer the phone.
Must be you, because I called him and he answered.
Must be me. Must be going all crap. She's calling me again.
All right. So right now that's other complaint. Now, this is only I say only, but since the fine, there's only been one complaint, correct?
Yes, there's only been one. So since October 22nd, when Lenny went to deliver the fine, there's only been one that it came into the office. I saw it on the 26th. They sent it on the 24th.
Okay. I'm wondering, is he going to, how many more complaints before he fines again?
That I don't know. That's something I gotta talk to Lenny about. And then that's probably what he wants to talk to Mike Coughlin about.
Sure.
Since the property owner said he wasn't gonna pay it. And if he's not gonna change his ways. And if he doesn't and we get more complaints, how does that move? What do you do with it, you know?
Yeah. We are, November 1st is here, and have applications for restaurant licenses gone out, permits, whatever?
They will go out next week, the beginning of next week. Oh, and that was the other thing. When I talked to Lenny, and hopefully he'll come in tomorrow and we can get it out because he wanted to go out separately from the renewals, is he wanted to send a letter to the restaurants, all the restaurants, reminding them of what the limits are, you know, as far as the tables have to be 6 feet apart, you know, all that kind of stuff. And he wanted it to go out not with the renewals, and then letting them know the renewals will be going out on such and such a date. So that's another thing we're working on. But I wanted him to confirm with Mike Coughlin before we sent that kind of letter out.
Yeah, okay, good. All right. Thank you. And Tom, do you have anything else to add on this subject?
Well, just that where we've already kind of started on the road of doing fines for some locations that have been in violation. And again, just to point out, these aren't initial violations, these are based on repeated violations. So it unfortunately forces the hand of our, health agent to take the step that he's had to take in the past with a couple of locations where if they're just not amenable to correcting what should be corrected, the fining has been the way to get the attention, I guess, of the owner, so that they will bring their establishment into compliance. So I think we need to be, but we started that process, and that's what's been in play. I think that needs to stay consistent. However, I would like to verify that if what we've been doing is valid, and it sounds like that with those calls going out to Ron and to subsequently Mike, we'll get that feedback. But we only asking all establishments operate the same, have the same respect for their customers and also the employees for that matter. And we can't distinguish one from the other irrespective of popularity, if you will, or length of time existing in the town. We have to treat them all the same.
That's right. Alan, do you have some thoughts on this?
I find it an unfortunate situation, because the steakhouse is well known and well respected, and the owners are very supportive of the community, as are other owners of other establishments in town. I think the part that bothers me the most is that they're not willing to change the way they're operating. It's one thing to resist the fine, but there really is no other solution other than to correct these health issues that are in violation of the current health situation that we're under. That's kind of a non-negotiable. So I'm disappointed that we can't find a way at this particular moment to work this out. And another concern is, unfortunately, the calendar is going to turn to November, and the weather is going to become uncooperative for outdoor dining. And I don't want these restaurants to or eating establishments to have to close because we have a spike in cases, and we have to go backwards in our reopening. So I really hope that the steakhouse, along with everybody else, will either reconsider or continue to do everything that they need to do to stay open. Missy, any current COVID cases in town?
No, not that I'm aware of. Ann didn't say anything to me tonight when we were at the flu clinic. So I'm going to assume that we're still at the 3 that we had. I think it was last week.
Okay, but no new cases.
No new cases that I'm aware of, no.
All right. Well, that's good news. I hope that we can work together with the steakhouse and iron out the next issue that we have in front of us. I do agree that maybe a letter with a separate letter, a reminder, and taking into consideration that the weather is going to change from Lenny, separate from the renewals. I think that's a great idea. Back to you, Mr. Chairman.
All right, thank you. I think we've beat this one up pretty good. Now it's just a matter of waiting to hear back from the 2 gentlemen we've reached out to, both Lenny and Missy, and see what we can come up with. I think that's it for right now on that subject, but we just have to wait and see how this pans out.
Okay, are you guys, so are we done with COVID as a whole? Or do you guys have anything you'd like to add?
I think we all pretty much know and understand how serious it is and how it's turning the wrong way, and we're all doing what we can. And so far, I just reading a story on Facebook about a guy who blatantly, someone I know, that blatantly says, I go in. The woman was talking about face masks and how do you rip it off as soon as you step out the door, 6 feet from the door, blah blah blah. And this one guy stepped up and said, I don't wear them. My parents didn't raise me to be a sheep and a follower. And he went on and on. I'm saying to myself, you stupid SOB. Oh my God. But again, I'm getting sidetracked. But I think that's it for right now. We all understand the severity of it. We're doing the best we can, and we all can't wait for a vaccine or for this thing to just evaporate and go away like it was a bad dream.
I did want to contribute one update, if I may.
Sure, go ahead.
I'm just not sure if it's known in general. This is something that came to my attention the other day. Apparently, it was announced that the current administration, as part of what they're describing as a comprehensive national effort to fight the COVID-19 pandemic and to assist the nation's governors, the U.S. Department of Health and Human Services is sending a little over 2 million state-of-the-art Abbott BinaxNOW COVID-19 point-of-care antigen tests to the Commonwealth of Massachusetts. The rapid point-of-care tests, which can diagnose coronavirus infection in as little as 15 minutes, will be distributed at the discretion of Governor Baker's office to support testing K through 12 students, teachers, nursing home patients and staff, higher education, critical infrastructure, first responders and other priorities as the local administration deems fit. So I just thought I'd pass that along.
Thank you. I believe that's it for this subject. Next on the agenda, please, Missy.
Okay, so the next thing that I have is one of the previous meetings on the agenda was to discuss the septic tank replacement process. I don't know if you guys want to talk about that tonight or.
Yeah, we can beat it up a little bit tonight, and it's probably going to take many visits of this subject so that we can make sure we come up with the most educated plan that we can. I don't know if you guys remember, but this is the one over on Millbrook that triggered this for me when we have the regulation. It's not a regulation, whatever you call it, that Mendon requires a 2-compartment tank, and the 2 people that came forward to see if they needed to upgrade their system because they were having some remodeling done, but they had empty nest syndrome because the kids were moving out. I don't know if you guys remember this. Tom Ryder was on the call. Tom called the next day and said, although the field is satisfactory to handle the extra load of the extra bedroom, if in fact it was going to be occupied, but he felt that they needed to upgrade their tank. And I was against that because, first of all, there's been reduced flow because the kids are moving out. But second of all, that's an incredible cost. That's $5,000 to $8,000 somewhere in there by the time you get done with planting grass after you disturb everything. Removing a 1,000-gallon tank on a system that's working, it's not in failure. And I just feel that we need to have some trigger mechanism, maybe numerous ones, that states when we upgrade to a 2-compartment tank, such as we all know that when a house sells, that's one. If you're going to voluntarily upgrade your system because you know that the leach field is leaking or you've had a Title V, a lot of people do that to upgrade while they can afford it, while they're young enough. And if you're going to upgrade, yes, that's another reason why you should upgrade your tank also. But to just willy-nilly tell these people you need to upgrade your tank, we would be going around the whole town. And I just don't see it. Have you guys had an opportunity to think about that, Tom?
Well, a little bit, and I think to your point, I think it's probably going to take multiple discussions. But so you brought up a couple of guidelines here. One being, if the owner is looking to do an upgrade due to a repair, I guess I could see where under a repair environment we would incorporate a particular tank type. The other element you'd mentioned that comes into play in selling a home, if you do have a system, and correct me if I'm wrong, I don't know that just under the sale of a home situation, we're talking about if within that 6 months of sale, if during the sale process, when the current owner has a Title V inspection, if that Title V comes back as a failure, is that what we're talking about specifically?
Yes, you're right. That's a little bit more fine line, and you're right. I guess when I first mentioned it, I'm thinking to myself that if there is the sale of a house, this is a little bit different than if the system was in failure. But if there was a sale of a house, system was working, but the Title V inspection proves that it is not a 1,500 2-compartment tank, it should be upgraded. Do you think that is a good idea for the sale of a house?
Well, I personally would say I don't think that's necessary if the system is considered a working system. You just automatically impart that requirement to the homeowner, to the seller, or to the new homeowner. Because if they can show that the system is working through a Title V, I'd hate to see the extra burden be put on the homeowner coming in to do it just because it's something that we kind of put out there. I think there should be a more supportive reason, like say a repair, or like it didn't pass. And so as part of getting it to passing, and maybe even there's even a fine line in that, does just the fact that it's not passing necessarily have to mean that they have to go to a newer tank expense? Could the passing be created, or could the system become passing without necessarily having to impart forcing a new tank as part of it? Right?
Yeah, you're right. I guess I see your point. It is a burden of an extra expense, and if it was working, if in fact a leach field was saturated and needed to be replaced, that would be a major rebuild, repair of a system. And certainly if you're going to go that far, the tank should be part of the new system. Now you have the biggest and the best. But by the other hand, if it was just a failed D-box, which is quite common, if someone was just replacing a D-box, then maybe they wouldn't have to do the tank. I see your point, and I understand. Alan, any thoughts on this?
Well, I guess it depends upon how far we want to beat this up, because what if you have someone who has a 4-bedroom house and the kids have all left? So there's 2 people living in the house and the system is working fine. That doesn't mean that the new buyer that's going to fill that house right up is going to have the same situation, because now the system is going to be maybe being used to its fullest, where the empty nesters weren't using the system to the fullest. So I don't know. I guess, it's going to take some chewing to kind of figure this out and make it fair and safe. Back to you, Mr. Chairman.
Okay. Tom,
Andy?
did you have any? Yes, Missy.
Sorry. So just going back to that 2 Millbrook Drive. So my understanding is it's a 4-bedroom house. They're reworking the configuration of the house. Tom, on that one, Tom finally said only if they're going to sell the house. Now, the leach field is by 5 square feet, I think he said, was acceptable for a 4-bedroom house, but that the septic tank was only 1,000-gallon tank. So therefore, technically, the house is not compatible for a 4-bedroom. So then that's when he said to me that if they go to sell it, then they would have to replace the tank, because then the system would truly be designed for a 4-bedroom house. Does that make any sense?
It does. It does. A lot of clarification there. Thank you. And that formula, the 1,000-gallon tank for storage of septage, is part of the Title V formula. Very good. Thank you.
AJ,
Yes, sir.
if I remember correctly, wasn't that that leach field more than adequate because of when it was built versus if it was built today with the amount of soil gravel? Wasn't that part of
Correct.
the decision?
Yes, correct. But the tank being 1,000-gallon tank does not support 4 bedrooms. That's why he wanted it upgraded. And something like that, along the lines of what Tom was discussing, as far as incurring extra burden on a sale, whether it's the seller or the buyer, in an instance like that, I think I would probably lean towards, yes, it does need to be upgraded. First of all, because of the age, if it's a 1,000-gallon tank, it's more than 15 years old. Second of all, it doesn't fit the criteria of Title V for a 4-bedroom house. You need the 1,500 gallons at a minimum, but we also have the 2-compartment rule, and that's only an additional $100.
And so I would kind
Well,
of
and
concur
also
with that line of thought. So I guess it's a balance between creating the requirement that we want to have in place as it goes against what is required by Title V. So I guess it's phraseology of it such that we have some flexibility where if we think we need to incorporate engineer's viewpoint, as he knows Title V, the best in terms of all the details, it kind of leaves room for us to then make a determination. So I think that's a good point.
Go ahead, Alan.
I agree. It's almost like you have to, have your rule, but then it's if the property sells or if, and also, in the situation of Millbrook, they know up front. They've got plenty of time to, a lot for the $5,000 or $8,000 upgrade when they sell the property. So, it gives the homeowner an opportunity to plan for this. It's not catching them blindside, and at the same time, by allowing that tank to stand as it is now, it's not because it's functioning, it's not allowing a public health hazard.
Right. Okay. What do you guys think that, somewhere we have the recommendation, Missy, you've got that in our rules and regulations and our recommendations and blah, blah, blah. Would we have a list of criteria as to when the trigger mechanism for this, or is it necessary, first of all? I kind of thought it was, and there's a lot to talk about, a lot to consider.
I
Is
think
that?
I think there's a lot to consider with a lot of things. So I'm looking at your installer application right now, and it's number 5, and it says that when there is a need to satisfy a repair condition, the septic tank must be replaced if the existing septic tank is 10 years or older. The type of septic tank required is a 2-compartment style tank. Other types of repairs in which would not require a replacement of the septic tank would carry forward per Title V regulations. So I think you've got a lot of variables. I think I had talked to Tom Ryder about this, and he was going to try and kind of formulate a almost like a policy and procedures type of thing.
Yeah.
Because we're having a lot of things coming up. I have another Title V that came in. The system is designed for a 4-bedroom. And it states it actually has 5. The assessor's record says it has 5. I pulled the building permit, and there was a building permit for an additional space over a garage that was attached to the house, or something like that. Anyways, but yeah, the garage was attached. They're going to put a room over the garage. The assistant building inspector back in 2004 marked on the building permit not to be used as a bedroom. When I talked to Jean in the assessor's office, she actually, I said, when did the assessors actually get into the house? She said in 2009, and it was a bedroom. So here's another situation. So we're going to have a lot of them, and I think sometimes it's got to be a case-by-case basis. I don't think there's going to be one process fits all, and it might be that we've got to start looking at, whether it's a Title V, whether it's a building permit application, to make sure that whatever the septic system is designed for, it's designed properly for the current owner and anyone who in future buys this property. Because we're finding a lot of times someone adds something, the building inspector didn't make them come and talk to the Board of Health. It's gone through a couple of hand changes, and now we see it. And now the current owner is going, wait a minute, but I bought this and I was told this, and you know what I'm saying?
Yes. Okay. We certainly can't come up with a definitive answer this evening, but please run it through your brains for the next few weeks, and we should solidify this at some point.
And I would add, this conversation actually makes for a great basis for a good reason for us to try to do a maybe a multi-department meeting to kind of discuss something like this, and so that, you know, there are so many different departments that, you know, home buyers and homeowners have to go through to get things done. I think it's very important that the key elements, such as this, that the folks in those departments are all on the same page. And it seems to always come down between a viewpoint from building and a viewpoint from Board of Health seems to be the point of contention. So I think we should maybe, if we, you know, try best that we can to somehow, as a group, get, you know, have a meeting and try to work through the mindsets, because I think that's where a lot of the issues tend to lie sometimes. Mr. Chairman?
Agreed. You just have to try and formulate it, and then that other issue we were discussing earlier would also be with a multi-board meeting. Would be good to, because we're going to have to get this out there. We're going to find out. But again, I would like to have council's opinion on this before we have the meeting, so we know what we're talking about. Otherwise, we're all just flapping our gums.
Well, maybe as a condition of the meeting or as a inclusion into the meeting, if we can do it, I would think council representation should be part of that as well, so they could speak to the legal aspects from, you know, from both the building's viewpoint and Board of Health or whoever else might be in there. Maybe
She
even
should be part of that meeting.
Yes, yeah.
Yeah, agreed.
You're talking with regards to the routing stuff, right, Andy?
Yes, dear.
Okay, yeah. I think you guys, I think there needs to be a meeting between Board of Health, the building department, maybe the assessors, conservation, they don't get into the mix too much, but yeah, because you have the building code and then you have Title V. And you would think that the two would work together, or they would, you know, interchange with, you know, but they don't. So you have, you know, one standard for building department and what they follow, and then another standard for what we go by with Title V. So I think it would be a good idea for at least those two departments to work together and figure out what we can, what we can't, and hammer it out and go from there.
Would you also see a benefit in having the upper representation from the upper town administration involved, such as either Kim or select board representation?
Sure. I mean, the more the merrier, so that everybody knows what page they're on, and that everybody can, you know, voice their opinions, concerns, whatever. So that way it's a team effort instead of just one department working against another department. But I think it's a great idea.
Absolutely. Okay,
So
let's do it.
sounds okay. That's a plan. The next thing I have,
Do we initiate that, or how is this gonna, I don't want to see it fall by the wayside. How are we gonna go about generating this meeting?
I can reach out to John Erickson, and he's the building commissioner, and see how he feels and how he would like to do it. And whether it's just a conference call like we're on right now and getting as many people on board. But that's where I would start.
I like that. Could you do that, please?
Yep.
Hey, Missy.
Would you-
Yep.
Sorry, this is Dan. I just popped in for 3 seconds because I overheard this. I just would tell you, I literally had this exact conversation with John and said the same thing, that I think they need to set up a meeting with these people and figure this all out.
Yeah.
So I think definitely if you guys reach out to him, that would be really helpful.
And I think my understanding too is I think John has tried to reach out to Kim and stuff, and I don't know how often, I don't know how forceful, so to speak, he is about it. But I think that if the building department and the Board of Health get together and together go to the selectmen or to Kim to try to facilitate this, to get this moving and going, I think would be better.
Absolutely. Okay, hopefully you get some results. If you can reach out to John, please.
Sure, I'll try and reach out to him tomorrow, and I'll ask Gail for his cell phone number.
I have it. I'll text it to you. Thank you, Dan.
So if you guys are all set with that, the next thing on the agenda is 65 Hartford Avenue West. Did the perk test. I haven't gotten any plans. I think Tom Ryder or Lenny, one or the other, needs to compose another letter to be sent out that when is the system going to be installed? It needs to, winter's coming, and we need to have that situation rectified. I have
You
not.
ready to remember what the date was when I went and served that letter?
Hold on. A long time ago. I don't know off the top of my head. I think it was somewhere
Early July, maybe somewhere around there.
around there. July. Because the perk application came in July 29th. So,
Okay, so it was the beginning of July. Okay, thank you.
yeah,
So it's been plenty of time that there should have been some kind of action. He did the perk test. And now,
right.
do we even know if the perk test was done? Did Lenny witness it?
Yes. Tom
Okay.
Tom Ryder witnessed it. And
Oh,
then
that's right.
the house was up for sale, but I haven't seen anything come through that it actually sold. So I think, just like you say, you don't want anything to fall by the wayside. So I think another letter needs to be sent and say, okay, what is your game plan? How are you going to go about this?
And you said that Tom Ryder is working on that?
I'm going to ask him to,
Okay.
because he witnessed
All right.
it, and there needs to be a letter. So unless you guys have anything else on that one, everyone okay with it?
I am.
I'm good, thank you.
Are people still living in the house?
As far as I know, yes.
Okay, so it is rather urgent that it gets taken care of, but I was under the impression that he was gonna sell the place because he couldn't afford to put the new system in. But I'm good.
That was my understanding too, but nothing has, at the end of July, I mean, we're heading into November. I just don't want it to fall by the wayside.
Have plans been submitted for a system?
No,
Nothing.
nothing, just the perk testing, and that was it.
Okay.
So if everyone's good with that, the next thing that I put on was discuss the flu clinic. You guys had your flu clinic tonight, and you had about 100 residents show up. I think it was one of the best flu clinics we had. I think the idea of the pre-registering was fabulous. I think it worked. I think no one was crowded. I think it just worked really well. It gave the VNA an idea of how many vaccines they needed. The flow was really well. People came in, people left. People came in, they left. There was, everyone followed the COVID standards, and I think it really went well. I don't know how you guys feel it went.
One little bit I saw, it was good. It was.
Yeah,
While
aside
we're
from
out.
my left arm being a little sore, I'm good. No, I think it went very well. I think we've learned that some good things here we can take from it and implement for future. I think it definitely pre-registration, aligning the slots, and it's a great way to go for future clinics.
Very good. Is that everything?
That's everything that I have on the agenda. The only other thing I would add on, I don't know if it's old business, I don't know where you want to put it, but I forward you guys off a copy of the special town meeting warrant. Apparently Article 6 is where they have put in for the revolving account for Board of Health for $25,000 for engineering. Again, I don't know if any of you want to go to it to attend it. I don't know anything about revolving accounts, how it runs, how, any of that. So I just wanted you guys to be aware of that. And then the only other thing I have is if you guys have had a chance to read the minutes from September 16th, I think it was, and June 10th.
I have not read them yet. Alan, have you read them?
Nope.
Sorry, Tom.
Well, that's quite all right. We've been very busy. No worries. I know we have a few to catch up on, but we've had other priorities, so.
Alrighty.
So, I mean, that's all I have for you guys. If you guys have anything for me, or anything else, old news, new news that you guys wanted to bring up.
So just a clarification, Missy, for what's coming on the special town meeting
Mm-hmm.
with that warrant. So this was to specifically allocate the funds that will be representative in what we believe is now an established revolving account for the Board of Health, correct?
And then give the
Because-
funding at the same time.
Because we were informed during the summer sometime, through the Finance Committee that the actual action of creating the account had already happened, but what hadn't happened was the allocation of the monies that was going to be applied to the account, which I think we were all confused by. First step had ever actually happened.
Yeah.
Am I
Missy.
thinking correctly on that?
This is Dan again. What happened is they put the bylaw to create your account, but then in the next article where they set the spending cap, it wasn't on the warrant, so they couldn't vote on it. So I think this article is to set the spending cap on this new account so you can use it. Like, I think it's more of a housekeeping issue.
Okay, so Dan, with that said, then, do you know when specifically this took place? Because we seem to be in kind of the know that this ever happened.
Left in the dark.
I don't.
Yeah.
To be quite honest with you, I think this is a typo that got. Remember when you did your trash thing and they pulled it and then it stayed on the warrant, they passed it over?
Mm-hmm.
Yes.
And for some reason, they just keep putting it back on the draft warrants and going, oh, wait, that's a typo. And then somehow it got left on. I don't even remember now. I'm trying to look at the warrants and I don't see it.
The reason it keeps coming back and the reason it keeps haunting them is because it's something that should have been done years ago. Back
Yeah.
to you, Mr. Chairman.
I think, I wish I could remember now. Nothing's on the warrant. And I don't even think you have, what's on this warrant?
This one, it's Article 6.
Where's the draft?
Yeah, and the only reason why I knew about it is because Gene sent me the draft because they don't send out the warrants like they used to.
No, and I think I got it for some weird reason.
And what's the date for this upcoming STM?
November 19th, right?
November 19th. Okay, and that'll be by a audio call like this, right? There won't
No.
be any.
In person at MISCO.
Oh, this will be in person format. Okay,
It
very
has
good.
to be.
Okay, yep, just checking. Thank you.
Yeah, so when I look at
I don't think you have a revolving account because you're not in the bylaw.
no, when you look at the warrant from the special town, the annual town meeting of this year, and that little grid thingy for
Yeah.
the Board of Health's not there.
This is wrong too. So it used to be you voted on each revolving account annually, individually.
Right.
Then they
Correct.
changed it in the Municipal Modernization Act and you had to do a bylaw to create the account and then you just vote the spending cap.
Right.
And the bylaw has library, planning, highway, Concom, and parks. And I think they just left Board of Health in this article. I think it was in his motion. It wasn't on the warrants and Gene made him pull it.
Right. I remember saying something like that.
So I actually don't think this article that they're going to vote on is going to do anything because I don't think the bylaw exists. But maybe
Well,
that's a question
the
for council.
bylaw in general, though, for those other departments, that was created, was it not?
Yeah, but this is creating a
Okay.
spending a cap for a revolving account that doesn't exist.
Okay.
If
So,
I'm,
but the general bylaw for the other departments you listed, that's in play. That was
yeah, it's a
approved.
big chart. So you'd add a
Yep.
new, well, you'd add a new one to the bottom.
Okay. All right.
I don't know.
Yeah, because the article for the special one is to see if the town will vote to set the revolving fund in accordance to Mass General law, blah, 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 and take any blah, blah, blah. Title V, Board of Health, 25,000. So, yeah, Dan, I think you're right. It wasn't even approved at annual, and they're talking about a spending cap in this article. So something's not right on it.
I have this vague memory of being at FinCom and Mike Maroli was going and he read it and somebody said, oh, wait, no, that's a typo. And then he said, oh, okay. And then it came back at the warrant again.
Yeah, because someone keeps repasting that over and over and over again. And it's not correct. So.
It's me.
Okay, Alan, you're to blame.
I know I'm being recorded, but I'm tired of the lip service.
There you go, Alan. I'm with you, buddy.
So those were the things that I just,
It's time to get it done.
right? So, those are the only things that I have for you guys, unless you have something for me. The next thing would be to do is set your meetings for November. And, looking at the calendar right now, the only available Wednesday really is November 18th. It would be one meeting that month, unless you guys decided to change to, I don't know, because unless you guys decide to go November 10th or 12th, because the 11th is Veterans Day, which is a Wednesday, and that is a holiday.
Whatever you want.
I'll do the 18th. I mean, if anything did major come up or something, I mean, we can always post and discuss whatever's come up, but it's up to
Mister,
you.
I have two questions.
Sure.
Did you talk to Max about the bond book?
I emailed him and I have not heard back from him.
Okay, and about Sunny attending one of our meetings from Simple Recycling, just so
Yeah.
that we can try to work out some of these kinks and keep this program going.
Yep, I can ask him to attend the
Thank you.
November 18th meeting if you guys want.
Sounds good to me. We've been waiting for him.
So
All
if
right,
you guys,
I'm good.
if you guys don't have anything else, I'll sorry, Andy, I should keep my mouth
No,
shut.
you're doing fine. You're doing fine.
I would say if you guys are good, I would ask for a motion to adjourn the meeting.
Well, I'll motion to adjourn. I'd also like to thank Dan. Thank Dan for your input. That was very helpful.
Thank you, Dan.
Yes, Dan. Yes, Dan, thank you, and I'll second that motion.
Thank you.
Dan is a wealth of information.
Yes, he is.
He's a huge
And a
help.
hard worker.
We
And a very
gotta
hard
go
worker
out for a
the
couple
town.
of.
Thanks.
We gotta go out
thanks.
for a couple of drinks, Dan.
Jumped on for 3 seconds after
I got some more
CPA.
information I want to get from you.
All right.
Thank you all. Good night.
Good night,
All right,
everybody.
thank you.
Thank you.
Good night, everyone. Bye-bye.